Thank you, Morris. Having given the broad view and overall picture, I'll focus specifically on what are the ICT applications we have specifically available to address the Millennium Development Goals. So for next about 10 minutes or so, I shall be speaking on leveraging information and communication technologies for achieving Millennium Development Goals in healthcare and where we stand in our own country. So as he's given you the overview that what are the Millennium Development Goals we are talking about, basically the Millennium Development Goals place healthcare at the heart of human development as well as economic growth. So there's a huge, as many as 3 goals directly deal with healthcare and another 3 deal indirectly with healthcare. So the goal 4 is to reduce child mortality, which in our setup as of now is 50 per 1,000 life births, that is the infant mortality rates. And the children who are not immunized against measles is 60%. So I'll give you some figures, facts and figures for India. The goal 5 is for improving maternal health. So for each goal there's a target that we look forward to achieve by 2015. And there are indicators that how we measure that target, how well we are progressing in that specific goal or area. So goal 5 deals with improving maternal health, and this has to be reduced by 3/4 by 2015. So the present maternal mortality rate for us are 300 per 100,000 live births. And target 5B is to achieve by 2015 universal access to reproductive health, which is also inadequate, and there's unfinished agenda as far as meeting the family planning needs of the people. Then goal 6 deals with combating with infectious diseases, the 3 major infectious diseases, HIV, AIDS, tuberculosis, and malaria. So we still have problems with these diseases. Malaria, we have prevalence of 14 per 100,000 population, and death rate is 3 per 100,000 population. And tuberculosis also we are still not able to control. It's 300 per 100,000 population, and death rate is 25 per 100,000. So the target is that have halted by 2015 and begin to reverse the incidence of malaria and other major diseases. And for HIV AIDS is to have halted by 2015, and we have made some headway. The number of people living with HIV AIDS has reduced in the recent past. So another Millennium Development Goal, especially the target 18, also says that we have to utilize technology in achievement of these goals. So some people who are skeptic about ICT applications or technology, so it's not figment of imagination of some geeks. There are definitive applications, and it can help achieve us certain advantages. And the advantages are that it is not only a big enabler, it is also a differentiator and integrator in achieving universal and quality healthcare. So it can transform the delivery of healthcare with positive clinical outcomes. It can contain costs. So it's not expensive. It may appear to be initially invasive and cost intensive, but in the long run, it recovers the cost. It reduces turnaround time, makes workflows more efficient, reduces workload, medication errors, improves patient safety. There's faster access to patient medical record. And another good thing is that it leaves all transactions leave an audit trail behind, and it helps us to comply with the government regulations. So these are some of the advantages. Now, when we talk about ICT applications, they are not dealing with the swanky hospitals kind of applications which they are using, maybe CPOE or the EMR or the hospital management information systems. They have an application, but in the confines of the hospitals, tertiary level care hospitals, or even small nursing homes. But to achieve Millennium Development Goals, we have to go beyond the 4 walls of the hospital, and we have to have applications, ICT applications specifically designed for these targets, and they have to be in public health domain. So NRHM is one flagship program of Government of India where a health statistics information portal has been opened. It is tool for advanced data analysis, reporting, monitoring, evaluation, and program management. So there's more efficient public health planning and forecasting for service provisioning, emergency preparedness, and resource mobilization. The overall objective is to have data for action which can be used for improving the health care of the people. Then another initiative by the government, Ministry of Health and Family Health Welfare, has been the Integrated Disease Surveillance Program. So it is a state-based decentralized surveillance program intended to detect early warning signals of impending outbreak and help initiate an effective response in a timely manner. So this addresses Millennium Goal 6 to overcome and combat major infectious diseases. It is also a major ICT application, and when combined with other meteorological data, GIS information, GPS information, and metadata, it helps in prediction of epidemics and disaster management. So that is a very important application of ICT in the area of early warning and response system to disasters, not only the disaster, natural calamities, but also the outbreak of epidemics. Like if there's an outbreak of infectious disease, vector-borne disease like cholera, SARS, it can be quickly analyzed using GIS tools because there's some changes in the vegetation or the mosquito population or the water bodies or the bird migration. So with analyzing multiple data, so it's not solely an ICT application, but it is a blend of technologies which is applied for the alleviation of ill health. Next important program which has been doing extremely well from the success story which is from the ground level is the eMamta program, which is a pregnancy and child health tracking system from the state of Gujarat. So it was launched in Gujarat. It is a comprehensive IT application for mother and child tracking system for pregnancy till complete life cycle for better public health services delivery, covers the entire rural, urban, slum population. So it's not only confined to BPL population. So this application generates unique health ID for every mother and child. It ensures complete continuum of ANC delivery to reduce IM&R, MMR, and it has made good progress. There have been large number of families that have been covered, who have been enrolled. Even the dropouts and people can be reinducted. The dropouts can be tracked. The number of infants registered has been 4.2 lakhs, and members who have been enrolled is 4.6 crores. So that's a large number who have been benefiting from this scheme. This is a feature-rich application where the work plans to provide list of targeted beneficiaries. There's full integration of service delivery and reporting. There's no duplication of data. There's complete life cycle approach, that is till the child grows up from birth to death. And it is a citizen-centric, the SMS alerts that can be sent to beneficiaries. There's complete integration of health record of an individual, not only data management tool, but service delivery management tool also. There's a complete list of ASHAs, ANMs in this program. There's access to private providers, the convergence with other healthcare programs also. Database of all service providers and communication perform. So its performance can be monitored on a quality dashboard with various parameters like what is the immunization coverage, what is the growth chart, and nutritional status of pregnant mothers. So this is an application which is being benefited by a large number of people, and other states are also planning to replicate this application, and this directly addresses the goal 4 and 5 of the Millennium Development Goals. Then in the neighboring state of Rajasthan, there's a district called Dungarpur, which is a backward district. Tribal population is there. They're also using a pregnancy tracking system. It's a IT-driven solution, which is a software created by IL and FS firm based in Delhi. The information is sent by ANMs at the sub-centers through mobile text messaging as ASHAs report to them regarding pregnant women in their areas. So the complete obstetric history, depending upon the number of deliveries and abortions and EDD is recorded in live database. Data is given to the blocks and then to districts and monitored at DC's office. So this also addresses the goal 4 and 5 of the Millennium Development Goals. So this tracks women during antenatal care when approaching EDD, advise them for institutional delivery. It can also track children after birth from